almost every world religion, especially the Christian religions, were against birth control. In the 1920s, the Anglican Church was the first Christian church to at least formally say that it was okay to use birth control within a marriage as long as the husband and wife discerned together whether or not, spacing children or not having any more children was prudent in their marriage. So the 1920s kind of opened the floodgates of permission, if you will, for the Christian faiths to say, yes, birth control might be okay as long as the discernment within a family is there. The Catholic faith has still maintained that birth control is still not okay. So that is the one faith, the one Christian faith, and there's probably a couple, random Christian faiths throughout, spread throughout the world that still believe this, but the Catholic Church is the one that teaches no contraception, no birth control. But the 1920s kind of opened the floodgates of accepting birth control. So in the 1960s, prior to the 1960s, the definition of pregnancy was the moment of fertilization. So a woman was pregnant the moment the sperm hits the egg and a zygote is formed and a new life begins. That was prior to the 1960s. If you look at the American College of OBGYNs way back when, that was the definition in their textbooks. But in around 1960 to 65, the definition actually changed. The definition went from the moment of conception was the moment of pregnancy to the moment of implantation, meaning that that zygote that was fertilized is now implanted into the uterus. That's when pregnancy begins. So they changed the definition of pregnancy. And you might ask, why did they change the definition of pregnancy? Well, I'll tell you. In the 1950s, pharmaceutical companies started looking at ways to prevent ovulation or pregnancy, right? So in the 1950s, some pharmaceutical companies were looking at higher doses of estrogen and progesterone levels. And the first medication they started looking at were high-dose estrogen pills. The estrogen pills, birth control pills. And they were testing it on women, fertile women, and they found that the high doses of estrogen actually stopped ovulation. So if you don't ovulate, you don't get pregnant. So the pharmaceutical companies were excited about this. However, the women taking the birth control pills were not excited about this because they were having headaches, sweating, nausea, vomiting. High doses of estrogen don't make you feel very good. So they found that the women who took their medications felt awful. And then some people didn't take the medication, so they were getting pregnant because if you don't take the medication, you're going to ovulate and get pregnant. So it wasn't effective.